The warning is an alarming one. The World Health Organization announced that over half of Europe's population would likely catch the Omicron variant by March.
Omicron variant represents a new west to east tidal wave sweeping across the region on top of the Delta surge.
Already, hospitals are feeling the shift. In Paris, for example, during the last week of December, some 54% of COVID admissions were Omicron. And in ICUs, 19% of the patients had it. The move from Delta to Omicron could provide a glimmer of hope, alongside vaccines, which help prevent severe cases. Some 14% of those hospitalized with the Delta variant ended up in intensive care, while only 5% of those with Omicron did. More contagious, but potentially less severe, the time spent in hospital is also different.
It's a lot shorter for Omicron, it's much longer for Delta. The quasi-totality of patients in ICU that have a severe form of COVID have been there for several weeks. They are in extreme critical condition, and they're all contaminated with the Delta variant.
Even if Omicron is thought to be less severe than Delta, it could nevertheless push hospitals to the brink with the sheer number of cases. Already, Omicron's breakneck infection rate has already exceeded worst-case scenario projections.
If the peak is in 2 weeks in regard to the number of cases, we're waiting for the peak in ICUs to be in the first half of February.
Studying nations like South Africa, where the Omicron peak has come and gone, scientists hope that the drop in cases could be as swift as the upward surge. But until then, hospitals are bracing for a hard winter.